Hello everyone, I'm Dr. Soumya Saluja from THIP Media, and today we are going to discuss the current concept of cancer in Ayurveda. Cancer is the modern day demon. Although the present era medical system has undergone manifold advancement for the management of the condition, nevertheless, the side effects associated with the very treatment has compelled the cancer patients to look for an alternative pathway for the very treatment. Ayurveda is one such system. Now, for enlightening us on the very topic, we have with us Dr. Reena Arora. Dr. Reena Arora is a learned Ayurvedic expert who has been practicing for the past 24 years. She has also worked at the International Herbal Center of Amrita Ayurveda for 4 years and is now proactively involved in the spread of healthcare awareness. Dr. Reena, THIP Media welcomes you. Ayurveda is the ancient traditional medical system of India that explores life at different levels. Uh, Therefore, I open this discussion by asking that what do these ancient scriptures state about the treatment of cancer?
In Ayurveda, there is not a disease mentioned cancer, but many diseases are treated like cancer in Ayurveda. This depends upon the etiopathogenesis of disease, that is samprapti, how the disease is progressing, and depending upon the doshas, vata, pitta, and kapha, we decide the mode of treatment and other modalities.
But the disease has evolved,
Yes.
and so have the causative factors.
Yes.
So, are there any methodologies that have been mentioned in the ancient scriptures for the treatment of modern day cancer? And if yes, does the modern research approve of these methodologies?
Yes. The Panchkarma treatments mentioned in Ayurveda are very helpful in cancer patients' treatments. Rasayan therapy, because there is very low immunity, weakness, falling of hairs, and many other symptoms, which can be easily treated by Ayurveda. And the dietary therapies, environmental therapies, and other healthy regimes like yoga and pranayama also help. So these all will help in treating a cancer patient with some other internal medicines, which are ras aushdis mentioned in Ayurveda. People can take these medicines from a qualified Vaidya only, because these are some typical medicines which are used in cancer patients. And these methodologies are described in Ayurveda in different contexts. We treat the cancer. I can name two, three diseases which are treated like cancer. One is Arbud. This is the synonym of cancer you can consider. And two, three more diseases like Sannipata Vran mentioned in Ayurveda. And in this way, many other diseases are treated like cancer. So these treatment methodologies like Panchkarma and other internal medicines and dietary therapies are used in treatment of cancer.
So, would you recommend a cancer patient to solely rely on Ayurvedic treatment?
I will say no, because if a patient is coming in very starting phase, in this phase, the patient, he or she is not aware that he or she is suffering from cancer. So this time is appropriate for Ayurvedic treatment. But if the disease is progressing and it's in first or second stage, then I will advise that you should take both the medicines. You should go for integrated system of medicine so that the patient is perfectly fine after these treatments, because any one system is not sufficient in progressing cancer, not non-allopathic or Ayurvedic. Both can work very well in this disease.
Okay.
And one more question, Soumya, you asked me previously, that is this treatment proved by modern parameters? I will say one thing on this platform, that we should not try to prove Ayurvedic treatments on the modern parameters, because the system, the treatment, the doshas, and all the modalities are different in both systems. We advise diet for every disease, and this is fruitful in the treatment of the disease. In allopathy, I think they don't advise much dietary advices. So this is one example that the treatment modalities are totally different. So we should not prove a disease or any research on the basis of modern parameters. Ayurveda has its own parameters. We should do the research on these parameters only.
So, as you've just said, that Ayurveda could be used or utilized as a complementary medical system. So, what exactly should a cancer patient keep in mind while seeking Ayurvedic treatment?
When a cancer patient is taking Ayurvedic treatment, he or she should follow all the advices given by the doctor. The dietary regime is of much importance. The daily lifestyle routine is of also much importance. Yoga, pranayam, and all these things which are advised with the treatment should be followed. And religiously, the medicines should be taken as advised by the doctor. There are many decoctions. These should be taken in this form in which they are advised. So this is the advice which I will like to give every person who is suffering from cancer.
And there's one question I'm really curious to know about, is that are there any side effects associated with these herbal therapeutics?
There may be side effects if you are not consulting a qualified Ayurvedic practitioner and you are taking the medicines from Googling yourself or from social site platforms. You should consult a doctor. Every patient is different. Even the disease may be same, but the treatment may be different in case of Ayurveda. This is a personalized system of medicine. We cannot give one medicine like allopathy that you take paracetamol for fever. We give different medicines for same disease also to different patients. So this is only one thing which I will like to advise here, that always consult a doctor before taking any herb.
Well, Dr. Reena, that was very informative, and I hope that this discussion would be helpful for the ones who are fighting with cancer. Thank you so much for joining us today. Thank you so much for your time, ma'am.
Thank you. Thank you for inviting me.
Thank you so much.